Welcome to Florida's First Coast Black Nurses Association's Men Health webinar. Today, I am so fortunate to have as my guest in studio with me, Mr. Adam Smith, nurse practitioner and fellow Florida A&M University alum.
Thank you so much for having me, Terry.
Welcome. All right, today this is so important. Today we're going to shed light on just a few topics: heart disease, diabetes, kidney disease, medication, and mental health for men.
The biggest men's health issue that men should be aware of is they just don't go to the doctor enough, or they go too late. I think when you look at men and their relationship with physicians, most don't go to their doctors until something is wrong. All men on an annual basis should have their cholesterol checked, they should have their blood pressure checked, they should have a prostate exam, they should have a PSA or prostate-specific antigen, if not every year, every 2 to 3 years, to help establish a baseline for evaluation of possibly clinically significant prostate cancer in the future. One thing men need to know: when they come in, they're often focused on prostate cancer. However, it's important that most men realize that heart attack, stroke, diabetes, hypertension are much more prevalent in the population than prostate cancer is. So while men a lot of times are focused on whether or not they have prostate cancer, we think it's important that they look at the overall big picture. It doesn't do you any good to look for prostate cancer and you not pay attention to things that you have control over, such as cholesterol, blood pressure, your diet, weight, and so on. The biggest focus for Men's Health Month is to get men to actually do preventive care, go to the physician. Our biggest issue with men is we know that they tend to delay going to physician unless something's wrong. We like to stress the importance to men that it is important to do preventive care, that it's important to have your cholesterol checked, to have your PSA, to have periodic colonoscopy to evaluate for colon cancer. Women do a much better job of annual or every other year surveillance for things such as cervical cancer, breast cancer, and so on. And we're trying to get men to know that it is important to do not only treatment when something's wrong, but also preventative care. One of the things when you look at men's health that would take someone to the physician would be erectile dysfunction. Something's not working properly, so they seek medical attention for that. The key for men to know is, especially younger men who have erectile dysfunction, is it's often associated with other medical conditions such as heart disease, such as diabetes, such as blood pressure problems, and so on. So erectile dysfunction in men, which would take them to the doctor seeking medications, may not just be erectile dysfunction. It may be a signal for something else.
We're going to start with heart disease. According to the CDC, heart disease is the leading cause of death among men in the United States. Half of the men die suddenly of coronary heart disease have no idea or no symptoms. Even those with symptoms may still be at risk. First, we want to start with Pastor Marvin Blunt. Mr. Blunt, can you please introduce yourself?
Yes, sir. My name is Marvin Blunt.
Your heart disease.
Yes, sir. My name is Marvin Blunt. I pastor a outreach ministry called Global Outreach Ministry in Jacksonville, Florida. In 2018, January 2018, I had a aorta to rupture and split. I was living in a city, Panama City, Florida. They had to life flight me out of Panama City, Florida to Gainesville, Florida, where they did a 14-hour surgery to repair the aorta. And it's been almost 2 years now, and everything with my heart is real good. The doctors are very impressed with the progress that I have made through prayer and taking medication that the doctors have prescribed, and just being on top of everything. But everything is good. I had a checkup a couple of weeks ago, and they say my heart rate was 55%, which was very good for somebody my age. I'm 64 years old, and this thing has happened to. But everything is real good. The aorta is healing properly. And at this point, I have no symptoms. I have no kind of problem with my heart at the moment.
Thanks for sharing. Thanks for sharing your story. That was incredible, Adam.
That is amazing. That is amazing. And as we all said, heart disease is, in some case scenarios, we would call the silent killer. And so, so grateful to the team of medical staff who cared for Pastor Blunt. Pastor Blunt, just a quick question for you after hearing your story. I'm just curious to know, after the surgery and after the procedure, what doctors did you have to follow up with? So, of course, I'm sure you had to follow up with your heart doctor, your cardiologist, as well as your family doctor, your primary care provider. How often did you have to make follow-up visits with them after your surgery?
I made follow-up visits with them every 3 months. They was doing a CT scan every 6 months when it first happened. And then we started doing it once a year. And now they figure I don't need the CT scan, but I was following up with my doctors every 3 months.
Awesome. That's great. That's great. Just curious, for those patients who might be listening to your story and either have experienced a story similar to yours, what would you say to them now that you are on the other side of recovery now? What would you say to them as far as any, if any, lifestyle changes or anything that you might have changed into your normal routine and regimen, in addition to medications, of course? What lifestyle changes have you made now that has placed you on a better journey to heart health?
Well, I try to keep myself out of stressful situations. I try to eat properly. And like you say, the most important thing is taking the medication as prescribed. Do not hesitate to go to the doctor if you feel anything that could possibly be happening that is not right, and talk to your doctors and tell them what's going on, and just ask them different things about it, and just to see what they say. But my thing is to just do the medication.
Reverend Blunt, were you on like any type of high blood pressure medication prior to this?
Well, prior to this, I was seeing a primary care doctor, and he could never get the blood pressure under control. And I know that's what led to it, to this thing to happen to me. But he could never get the high blood pressure under control. But then I also want to say this happened in January, and then in August the same year, it done it again. It ruptured again, but it split in a vein. I don't know how that looks and what's about it, but it split in a vein. And the doctor told me it was the blood pressure that they were trying to get under control. That they thought after the surgery they had it under control, but now my blood pressure is very much under control, and then everything is working good.
Great job. Did you change your diet at all?
Sir?
Last question.
Yes, sir. I changed my diet. I try to be careful what I eat. You know, we love grease, we love chicken, so we just try to do everything in moderation. You know, not to overdo it. And I just drink a lot of water, uh, a lot. But yeah, I try to eat a lot of vegetables and stuff like that, and start to eat stuff that's gonna help strengthen my heart. But at this point, I'm doing real good. I have no complaints at all.
Thank you so much. What an incredible story. What do you think, Adam? I mean,
Exactly.
and it is so important that men think about your health? Because so
Yes, sir.
often, you know, men are sort of leery about going to the doctor and that kind of thing.
Exactly. I agree with you, Terry. And, you know, Pastor Blunt said something so profound to
What was
me
that?
is
Which
that
one?
in taking your when he was saying that, one of the things he's learned out of all of this, out of his experience, post surgery and recovery, one of his preaching points, if you will, would be to take your medication, but not only take your medication, make sure you understand why you're taking that particular medication.
Yes, sir.
And if you have any questions about that particular medication, do not hesitate to speak with your provider.
Really, because your body usually will tell you when something is wrong.
Certainly.
All right. Great story. Next, we have
A local couple doing their part to help communities facing health disparities. The Pareto Clinic opened this week to offer care to patients. Action News Jack's Jamarla Phillips explains why the couple decided to open during a pandemic.
Dr. Kenyatta Lee and his wife runs the Pareto Clinic here inside the Swell Sweet Community Resource Center. They say they wanted to help bridge the gap of health disparities in underserved communities like this one.
In a big city like Jacksonville, you might think that it wouldn't be hard to find primary health care close to home, but it can be, especially if you need affordable care. That's why Dr. Kenyatta and Lakita Lee opened the Pareto Clinic in partnership with the city of Jacksonville, Edward Waters College, and Swell Sweet Community Resource Center.
We wanted to come back home to Jacksonville, and we definitely have always had a love to be in the community and be where the need is most.
The couple says the clinic will help neighbors in the area who are low income and don't have a clinic nearby.
You look at the disparities for, say, colon cancer or breast cancer or even something like COVID. It's because of the lack of access.
According to the Department of Health, in area code 32209, where the Pareto Clinic opened, there are 987 cases of coronavirus. Dr. Lee says now neighbors won't have to travel as far for care.
In some communities, you have 3 doctors on every corner. Here, you may not have a doctor for another 5 or 10 miles within this general radius. So actually putting these resources in the community stops people from having to go to the hospital, having to go to the ER.
And the clinic is open Mondays from 8 to 5. They accept walk-ins and same-day appointments. Reporting here in Durkeeville, I'm Jamarla Phillips, CBS 47 Action News.
Dr. Lee, can you please introduce yourself?
Absolutely. Good evening, good afternoon. My name is Kenyatta Lee. I am the president of Northeast Florida Medical Society, and I'm also a primary care physician. And I own my own practice, and it's called the Pareto Clinic. And it's on
Thank you so much. Can you speak to us real quick about Mr. Blunt's situation?
Oh, it's such a profound situation. I think you see a couple of things in that. One, he actually knew that he had hypertension, which was a good thing. He had a relationship prior to that. And the consequence that the mortality connected to, meaning the death connected to aortic dissection, is massive. And his ability to sense the symptoms, present to the emergency room, and then get the care that he needed is pretty significant. Of course, we know that heart disease is a silent killer, and it is the #1 killer of men in the country, and disproportionately the #1 killer of African American men, and then hypertension as one of those sort of factors that produces it is certainly incredibly significant to aortic dissection, strokes, and heart attacks. So it's a blessing that he was able to get the care he needed, and the fact that he's really engaged in minimizing the fried, delicious foods that we know are so prevalent within our communities.
Whoa, thank you.
Certainly, Dr. Lee, and as you said, with it being so common, definitely amongst the African American community, as it pertains to men specifically, I'm just curious to know, on a regular given day within just your practice, in a day of the patients you see, what percentage roughly would you say you find you have either patients in general or male patients specifically who are battling heart disease?
It's the prevalence is enormous, meaning the number of cases for heart disease is pretty significant. So I would say at least 70% of the men who come in have some major issue. I will say to you that the people who come in, we don't see enough men. And we know that men are half as likely as women to seek medical care. And so that's what the issue is. I see lots of it in men, but I don't see enough men in my practice, or certainly as many men as we should see. For things like that.
What about college students, since your clinic is located at Shell Suite Clinic over on Edward Waters University campus?
We see, it's so funny, the students are starting to come back. And so we see a nice selection of students on a regular basis. So we're functioning as both the infirmary for the students. So they'll come, and the first piece that comes are the students who come in for screenings for sports physicals. I think they start early. So we've been doing the footballs and the basketballs, and then the track, and then the soccer will come, and we look forward to. We screen all of those patients, and I'll tell you what I find interesting. We're seeing even in young people, 18, 19, 20 years old, sort of the first steps, step 1, stage 2 hypertension, and some of them with full-blown hypertension, even at that young age, never having known it. And when you ask the questions, you find like that there's a strong family history. So we see the students, and we of course provide care for the community as well. And the amount of heart disease and hypertension is enormous within that community.
For those people who are unaware, what is it that you can do if you're having certain symptoms? Can we talk about that? Like if you're a college student, stressed with studies, stressed with college tuition or family matters back home or whatever. So how can they deal with that?
So when you're saying there's a sort of the student wellness piece is what you're describing,
Yes.
And for men's health, I can tell you that's a huge issue. And I will say that we, of course, we provide function as an infirmary for the students, but we also provide care for the entire community within zip codes 2, 6, 4, 8, and 9. So we're a resource for the community and the students. I'll tell you, for both of them, the behavioral health piece within our community as it relates to men is tremendous. And so what we find is there's a lot of self-medication, and that medication could be anything, could be alcohol, could be drugs, and all of those things make it worse. So part of that sort of mitigation, how do you make it better? You gotta build that relationship. It's the students are fortunate to have behavioral health resources on campus. We're also able to triage them to other resources within the community, whether it's a psychologist or psychiatrist. And of course, the patients who will come in and see us, we're actively involved in referring them for behavioral health issues. And there's such a challenge with men and stress, and them not dealing with that stress, and using other methods. And what's interesting is the things that we use to mitigate, decrease stress, make everything in our health worse. So if you drink, your pressure goes up. If you eat those delicious chicken sandwiches, and I don't know if they make it a sandwich or what, your blood pressure, your sodium goes up, you get diabetes. All of these things so stress is a major factor when we look at health within our community, and our ability to manage that stress through relationships with our pastors, which I think is important, our physicians, our relationships with our wives, recreation, prayer, all those things make a difference in dealing with those issues.
Okay.
I couldn't agree more, Dr. Lee, and certainly a great talking point, as he said, is just to be sure that you are building a relationship with your provider, or finding that healthy support system to build that relationship with. Last question, Dr. Lee, is there anything else that you would like to share with the audience, just either regarding men's health overall, or just a good point to end on?
I'm not gonna take long, but I do want to sort of say the key factors. What we find interesting with men's health is that out of the 10 top causes of death in this country, men are winning, or not winning, and actually kind of losing. But when you compare men to women, we die more frequently for 9 out of those 10. So 90% of the things that cause death in this country, we're at that level. What's interesting is that most of those things, except for Alzheimer's disease, can be prevented. And so the conversation that we have is rich and meaningful. And I think that's important. So the key factors in terms of helping prevent that is you got to get your annual physicals. I see men doing a better job of taking care of their vehicles, their trucks, their cars. Some will have motorcycles. And every once in a while, you see somebody with a boat. They change the oil, they clean them, they shine them, they're beautiful. But they don't do that same thing with their health, unfortunately. So making sure that you have that annual follow-up, that physical, is important. Also, the last piece is making sure that you know your numbers. Check your PSA, know your number, know your cholesterol, know your sugar. The pastor mentioned that his blood pressure was in control. So making sure you know what that number is and that you're following it, and that what you mentioned is you're taking the medications, which I think is really important. So those basic concepts, I think, are literally the difference between life and death for most of the patients that we see, and the men that are within our communities.
And you're absolutely right about that. You know, so many men refuse to go to the doctor, or you're absolutely right. You know, they wash their car annually, like every week. But in terms of their health, how do we change that mindset? How do we change the concept? What do we do? And particularly with young people, most recently, it's very personal to me. I had a niece to die, 30 years old, health issues. So let's talk about that.
I think it's a great question. It's relationship, it's access, there are so many reasons why men don't go to the doctor. There's a culture that says that big boys don't cry, and going to the doctor. And I can say this with my own dad in mind. Knowing that he had an issue with his foot, and before he said anything to any of us about it, he had lost a significant portion of his foot. Making sure that we feel comfortable, and that being a man is not being, biting a piece of rawhide and a stick. It's doing what you need to do to get the care you need to get. The other piece is that men, unlike, I guess, the urban myth, the men in our community, and I'm working in zip code 09, where 94% of the people in this community are African American, are working hard. Some of them have, they don't have, like on Living Color, they say they have 15 jobs. They don't have 15 jobs, but I've seen people with 3 and 4 jobs. They may have a job that is their full-time, that has the benefits, and then they got all the different side hustles, if you can call it that they do as well. So they are really working hard to support their families, and don't always have the time, and in many instances don't have the insurance, and don't understand how healthcare works well enough so that they can actually get into a caring relationship with the provider. They don't realize that it costs less to see a primary care physician than it does to get an oil change for their Lexus. I mean, I'm just gonna be honest. It will cost less to do that than it will be to get an oil change. And so that's basic lab work, basic blood pressure, and that kind of thing. So there are a lot of reasons they're not seeking care and getting into care. Those are some of the issues that kind of come into it. And I think these types of discussions help bring attention to that and can encourage them to get into this space.
I am so happy that you said that, because I know with the affordable health care thing that's out there, and I know that some people could get health insurance for as little as $0. And sometimes it's just lack of knowledge, and I think that type of communication needs to go out loud and clear in our community, and people need to understand that if you don't take care of yourself, then who else will?
That's very true. That's very true.
Correct. Thank you so much, Dr. Lee. You have shedded so much light on a subject that men don't normally like to talk about, and particularly African-American men, because sometimes, it's that macho thing. I don't know what it is. Men are not supposed to cry. Men are not supposed to complain. But if you have health issues, it goes back to mental health issues or physical health issues, and you don't talk to somebody about it. You need to find that one person that you do feel comfortable with. Wouldn't you agree, Adam?
Definitely. Could not agree with you more. Definitely have to find that support person, that support system.
Correct. Somebody that will understand, and somebody that you can communicate, and somebody that will feel comfortable enough to communicate back with you. And particularly during this pandemic, how do you deal with a loved one's death? How do you deal with losing a job? How do you deal with your income being supplemented or not as much as it used to be? We have to talk about these type of things because of stress.
Certainly,
and
stress.
That's another thing that leads to high blood pressure and heart attacks and that kind of thing. Just trying to carry the load all by yourself. So today, guys, we want you to know that find somebody, trust somebody that you could talk to, whether that be your, your best buddy, your wife, your brother, whoever.
Exactly.
What do you think?
Exactly.
Okay.
Definitely agreed.
All right, our next topic, we're going to deal with diabetes. According to the American Diabetes Association, health is wealth. I like that. We encourage all men with diabetes to take what's called the Modern Men Challenge. Get out, get active, get involved, get information. Now, let's talk about diabetes.
Certainly. So diabetes, just as Dr. Lee stated, one of the many what we call comorbidities or chronic disease states or conditions that many patients are faced with, definitely amongst the Black and Brown community.
And why is that so? Let's talk about it. Let's kind of break it down.
Certainly. So that's a great point. So just as Dr. Lee was stating, if you look at the Jacksonville, Florida, Northeast Florida region, and you can literally Google by zip code, and you can see certain zip codes that are predominantly what we call underserved patient groups, whether it be through ethnicity. So in this instance, in the African American population, have what we call a higher risk of developing chronic disease states. So heart disease, high blood pressure known as hypertension, and then now with our current topic of diabetes. There's been numerous research and studies as to why these patient groups are more at risk for these disease states than others. My personal opinion, of course, is it goes to what we call, there's a topic called the social determinants of health. And so it's a triad of different things. We'll touch on three. One, of course, is health access, meaning that in some of these communities, a lot of patients might not have access to urgent care center or hospital. And even we'll go as far as, which might be another topic, but even as far as accessing healthy food. And that gets on the topic of food deserts. The third issue sometimes, as far as a barrier to care that places these patients at risk for diabetes and such, is what we call really transportation. A lot of patients in that population, in the African American patient population, really do unfortunately have issues with transportation to their doctor's appointments, making sure they're following up, as Pastor Blunt said, with his cardiologist and with his primary care provider. And so these are it's a huge issue among our communities, what we're finding. And lastly, what I would say as far as barrier to care, it goes down to the almighty dollar. Unfortunately, if you have an African American male who Dr. Lee stated might have 3 or 4 jobs, you might have a family of, wife, kids, 2 or 3 children, and you just run the numbers for the monthly expenses. Unfortunately, healthcare, specifically primary care, preventative care, might not be on the top of the list.
But for those individuals that are not aware, what's it called? The Affordable Care Act. I know it's out there. A lot of times it's free. You know, sometimes all we have to do is do the research.
Certainly. And that's that you bring up a very important point, that it is important to be aware of the resources that are available to you.
Right.
Do your research. And I always encourage patients, speak with your primary care provider, speak with family and friends who might, that you know of, might be accessing some of these resources, because there's a myriad of free resources, definitely within the Northeast Florida area.
And it's almost time for re-enrollment or something like that. I see the signs all over the place. Don't you re-enroll in September or October or something for the Affordable Health Care?
Certainly, I'm not sure as to
what they used to call Obamacare.
Right, certainly not privy to this exact date, but yes, but certainly there are multiple resources for them.
Okay.
But in going with diabetes, so definitely it's high risk among the African American patient population, specifically with our talk today in African American men. A lot of patients say, what is diabetes? A lot of us might know diabetes as high blood sugar, a medical word for sugar being glucose.
That's what my grandmother used to call it, the sugar.
The sugar,
right. You have the sugar, somebody's got the sugar. So what does that mean? Explain to the audience.
Exactly. So high blood sugar, meaning high levels of blood sugar, high levels of sugar in your bloodstream over time through lifestyle changes and sometimes lack of exercise, even what Dr. Lee, what we spoke on, stress, obesity,
Okay.
Even smoking, high blood pressure, can attribute to what we call insulin resistance. So every human being in our body, we have what we call a pancreas. And I'll just give you a quick note lesson on diabetes and have a pancreas. And so when we eat a meal, our body breaks down the food we eat into carbohydrates, proteins, and even into glucose. So
what about fried foods, fast foods, that kind of thing? High sugary foods?
Certainly. So even those foods are all in a normal body supposed to get broken down, and used by our body, turned into good sugar for energy. What happens is in what you call the standard American diet, such as the high foods, the greasy foods, and such fast foods that we're referring to, over time, we build up what we call fat or lipid cells in our bloodstream. And so it prevents glucose to go into the cell. Thus, the glucose or sugar builds up into our blood vessels. Over time, patients might complain or experience they're thirsty more than normal. They might be noticing that they're using the restroom more than normal. Might even complain of a little bit of just feeling more fatigued more than normal. These are all common signs and symptoms that I tell patients. If you notice this, or you tell your family member or loved one, if somebody's complaining like, well, that you notice they keep going to use the restroom, or they're drinking just tons and tons and tons of fluids, I would encourage you to go to your primary care office and get tested. Just as Dr. Lee stated, know your numbers.
Okay. When we talk about the food deserts, and I want to touch on that real quick, healthy diets. And in food deserts, you sometimes find more fast food restaurants. You find the convenience stores, and they have most of the food that's there is fast food and that type of thing. And some people, when the parent get off work, that's a kid, a hamburger every day or something like that. How do we address that? I mean, how can we address that in the community?
Certainly, that's a great question. And so I would encourage you in your local area, local community, just drive, literally take a drive. And a lot of us, it's your normal routine going home or going to work down the street through your community. And if you can tell me how many grocery stores do you pass by in those areas compared to fast food chains, the numbers will be startling. And so something I always encourage patients, and I know that there's a saying, if you will, I encourage patients when making choices, sometimes it might be hard to curb a habit. So if you're used to going to one of your more popular fast food chains, let's try to maybe select some of the healthier options from that fast food chain. Salad, perhaps. We might not always have to have a soft drink. Maybe let's go with some water.
Right.
So that's what I usually initially encourage patients to do, because again, when we talk about social determinants of health and feasibility, a lot of times if you have $5 in your cash in your pocket and the option is, okay, I have $5, do I eat? Do I go get gas? Or do I go to the doctor? Or do I save this $5 for money I'm stashing? A lot of times your health, unfortunately, just goes on the low end of the priority list. So that's something I encourage patients to do, is just make wise food choices, unfortunately, with the food options that you have in your area. Now, I always encourage patients, definitely when we are speaking on the topic of diabetes, is I encourage to my patients a whole food, plant-based diet.
Okay.
Now, that might be a bit extreme. Of course, it's a diet that really there's little to no meat, no fish, seafood, or chicken. Might be a bit extreme, but numerous studies by the American Diabetes Association, CDC, have all shown that a whole food, plant-based diet will definitely minimize risk, and even for patients who already have diabetes.
So what do we say to people that say, oh, no, I love the fried chicken, I love the fast food hamburger, I love the red soda, the strawberry soda.
Definitely.
Okay, definitely. And the fries and that type of thing. How do we change that mindset? Because we're going to segue right now into mental health,
Gotcha.
from this. So as we talk about these things, and as we talk about the male that has lost his job or don't have the same type of resources to support his family, what do we do? So how does all of that work together? And then talking about mental health on top of that.
Certainly. So, as you say, it would be hard for us. It would be, I almost hate to say, unrealistic for us to expect us to curb our routine and pattern that we've just been doing for years.
Of course, we could gradually do it.
Of course, gradual change.
Because it's a taste in the food.
Correct.
It may be not the grease because you can't oven fry chicken.
Right.
And the good thing about Northeast Florida Farm Share,
yes,
they're basically free food giveaways all over the place.
Certainly.
And there's nothing wrong with that. And once again, let's talk to men, because I know a lot of times we want to put on this macho act and act like, well, we're all good, we don't need anything. But who suffers? Your children suffers, your family suffer. You're suffering because you don't have anybody to basically talk to, correct?
That's correct. That's
Okay.
correct. And it's just all about identifying those stressful triggers. And so a lot of times, unfortunately, as we segue into mental health, when we are stressed, a lot of times, for many, someone's poison of choice, it might be food. And it's the most convenient thing.
Okay. So we have to change, once again, that mindset. And I know
Exactly.
sometimes it's hard to do, but we have to do it. And that's just like talking about COVID. Our children are getting ready to go back to school real soon. And people are worried. Mental health again. Mask, no mask. And whatever is most convenient and most comfortable for the parent, that parent has to make that decision. How do we?
We're plagued with having to make tough choices and tough decisions. So
Correct.
definitely in the era of COVID and the pandemic that we're going through now, high stress level situations, you would be surprised if you look at the relationship between the years of 2019, 2020, and even now in 2021, and look at rises of diabetes, rises of high blood pressure,
Right.
Rises of stress. How do we deal with these things? And so when it comes to men's health and even mental health, it's so important to just get that support person or group or system.
And not just sweep it under the rug and act as
Exactly.
if it doesn't exist.
Exactly.
Because that is so important to the community. It's so important to our health,
Definitely.
as men. And that thing, big boys don't cry. Sometimes you just gotta deal with what you have to deal with. A lot of us have lost friends, family members during the pandemic and that kind of thing. That deals with mental health. As I said, most recently I lost a niece. That was something that I had to deal with because she was like a daughter. How do you deal with it? And you can't take everything to the barbershop. It's nice to say, well, we can just go in the barbershop and talk about it. Well, a barbershop is a public open forum.
Exactly.
Sometimes you need to be one-on-one and have a conversation with somebody and just let your guard down.
Exactly.
And feel comfortable that you can talk with another guy about what's going on with you. And you'll be surprised how many shared and common interests you may have, and you may be on the same wavelength. Oh God, I couldn't talk to my wife about this, but I'm facing the same thing. How will she feel?
Right.
Well, sometimes maybe you just need to have a conversation.
Exactly.
Because nobody wants to be stressed.
That's certainly true. No one wants to be stressed. And so identifying support persons, identifying those triggers, and finding, even if you need professional support through counseling, to definitely so-called prevent the fire, but while it's just smoking.
Right. And
Definitely.
stress is, we all go through stressful situations, and stress is real. And when it comes on you, it comes. And sometimes you can handle it. Some guys go and grab a drink, a cigarette or a cigar or whatever, but you can't pretend that it will just go away because the next morning is still there. Same problem.
That's true. It's very true.
This has been very enlightening, this whole thing, you know, and I'm just so happy that Dr. Carol Neal invited us to, you know, just give our thoughts along with to all of the panelists. Thank you so much for all of your support and all of the information that you have given to the community today. I think it's something certainly that we should go back and talk to somebody about and just share.
Exactly. Certainly. Teaching points, take home points, talk to someone.
Right. And the good thing is it's on the internet. So it's here forever. So it's you know, you can always go and rewatch it in your spare time and get information. And I think it's so important, you know, AARP, what a great sponsor. And I think they're trying to provide this information to the community, and we should be willing to accept the information and go forward and see what we can do to help ourselves and our families.
Because that's what it's all about, right? Just being better for our families and ultimately our communities.
So what do we need to leave with? We need to think about, you know, to have the signs all over the place. I see them from time to time, affordable health care. You know, sometimes even as low as $0. Guys, we got to take care of ourselves. You can't wait till the last minute. You know, you hear too many times people say, well, he fell dead. He never been to the hospital or dead. And it's like, well, he never went to the hospital because he never went to the doctor.
That's right.
So he probably had those issues ongoing, and
That's
he
true.
just didn't know because he didn't check on himself.
That's true. And otherwise, also know your numbers. Know your numbers and going to your primary care providers and getting your routine lab work. And so we can really prevent a lot of these chronic conditions.
Correct. And sometimes, you know, I used to be accused of being a hypochondriac. I would go to the doctor for any and everything. Sometimes you need to be a hypochondriac because you know your body better than anybody else. You know, when you wake up and you feel dizzy or you don't feel the same and you say, oh, okay, in 2 or 3 days it'll go away, and it doesn't. Something's wrong.
That's right. If you feel something, say something. So it's all about establishing a relationship with a primary care provider when it comes to your health, and then definitely in terms of behavioral health, mental health, finding that support person.
Wow. This has been such an interesting and informative information session. And I do thank you, Adam, for sharing the studio with me. I thank all of our guests. You have anything to say? You want to leave?
Thank you so much, Terry, and to all of our panelists and guest speakers. We thank you so much on behalf of the First Coast Black Nurses Association for your time and in combination with the AARP sponsors. We encourage you in this time that we're going in, that everyone in the midst of the pandemic continue to have faith over fear, know your numbers, and be safe.
So Pareto Clinic as a practice was developed from its inception as a mechanism to address the tremendous inequities that we experience within our communities. One of the approaches that we've taken is the understanding that to eliminate disparities, you must have high quality. In fact, the studies that are out in the community really talk about the ability to leverage and improve quality to reduce disparities in care that exists. And we know that there are significant disparities that exist between different groups, whether that's racial groups or classes or sexes. We know that that's a huge issue. So one of the sort of exciting phenomena that's really happened in medicine in the last 15 years is this movement towards value-based care. That is looking at quality, looking at cost, and actually developing systems that allow you to focus on those bits and pieces. So population health is the management of populations to produce specific outcomes. What we see when we look at men's health is that there are significant disparities between men and women. This is actually quite unique. So of the 10 issues or factors that produce death in our society, both morbidity and mortality, we find that men are higher in 9 out of those 10. And that's pretty significant. That's a huge issue. So of those 9 that exist, a lot of that can be really managed with appropriate prevention and follow-up. Our practice at the Shell Suite Center here in Jacksonville is specifically developed to address those issues. We have evidence-based approaches. We use both technology that is pretty significant. We have electronic health records. We have the ability to do point of care ultrasound testing. We are structured where we actually are doing telemedicine with our men. Many men can't leave their jobs and come in to be seen, or we do follow-ups via telemedicine. We have the ability to do remote patient monitoring, which means that we actually have an app that will interface with your phone and whatever devices you may have, which will produce biometric data, whether it's a blood pressure, a blood sugar, a pulse oximetry. We can do all that electronically. So we have a pretty sophisticated practice that's really designed to approach those issues. One of the things that really concerns me about men's health is the impact of behavioral health on men's health. One of the challenges has been that, this sort of perception that big boys don't cry, and that we're just supposed to be tough and to take it and to bear it. And there's a tendency for men to self-medicate. What I'm seeing in my practice is a pretty significant self-medication. That medication may come in the form of food, which is excessive eating, and that sort of thing, which of course produces complications. It will come in the form of drug use. So alcohol, if used in extreme moderation, is not a bad thing. But certainly alcohol in the context of excessive alcohol use and addiction, it's horrific in terms of what it does. I'm seeing significant amounts of illicit drug use, which is cocaine, marijuana, heroin, cocaine in both forms, both crack and powder cocaine. And these are all things that are pretty deadly. I see there's an addiction to sort of sexual activity that I think reduces the stress and that sort of thing. So being able to get men into a space where we have those conversations is important. And a part of the doctor-patient relationship is therapeutic. So many of the men who come into our practice, they come in for just, they come in for the good word. They come in to talk. They come in to engage. And part of that is, I think, effective in reducing that. But we're also comfortable and capable of referring some of our male patients to psychologists and psychiatrists and that sort of thing. So much of what we see when we look at those 9 issues that produce such death and mortality within the male population are things like diabetes and hypertension, things like stroke and cancer, which are very common. And in many instances, if you catch it early, if you screen for it, or if you manage it appropriately, your numbers, you can actually reduce the likelihood that these conditions could produce death and long-term suffering and mortality. So we're excited. Our practice is here on the campus. We're growing nicely. And I love the fact that we have such a unique composition. Typically, my practice panel is probably 65%, 70% female. In our practice, we're almost 50-50. Where we have every spectrum of men. We have, of course, professionals that come in, presidents and vice presidents and different groups of people. But we also have guys that are blue collar, hardworking, men that work on the boats, that work on the ships, professionals, officers, firefighters, and different people who come in and get care as well and feel comfortable enough to come into the practice to receive the care. So we're in the community. We're accessible in the community, which I think is excellent. We're here 5 days a week, and we have multiple ways, and we take literally every type of insurance, whether it's marketplace plans, which I think is a really great option for many men who don't have commercial payers. With the marketplace, you get a really good exam with marketplace. Also, the commercial products, most people will have insurance through their jobs and don't use it. We take the social payers like Medicaid, and we take Medicare and Medicare Advantage. So there's multiple, and we do self-pay. So if you don't have any of those methods of payment, we can do self-pay as well. So that's something that we can do within our practice. So we look forward to, we've enjoyed, I've practiced in the community for about 15 years, almost 20 years. I moved around a little bit, but we're excited to be here and really excited to be in a position where we can do work that we believe will help extend the life of the men in our community and help be an access point where men feel comfortable coming to us and working with us. So thank you for the opportunity to do this. In fact, I will say that a nurse hired me, Elizabeth Means, who actually started the practice that I'm in now, hired me, and I feel blessed to be on this campus in a building that she started. And she met me when I was a medical student. and taught me a lot of what I know about whether it's men's health or health and what it is to be fully committed in a community advocate and asset. So I'm happy to be here, and thank you for the opportunity to share this information about men's health. Thank you.